Good morning, all. Thank you for joining us this morning. We are going to go ahead and get started since it's already 10. So this is going to be the Healthy Schools Act and Centers for Disease Control and Prevention School Health Profile Informational Webinar. My name is Carolina Arango. I am the point of contact for the Healthy Schools Act or HSA School Health Profile.
And my name is Ife Bankole, and I'm the point of contact for the CDC School Health Profile.
So today's webinar will last for about 20 minutes. If you have questions, please post them in the question board and we will answer them at the end of the webinar. So on the agenda for the webinar, we will first talk about the school health profiles. We'll talk about the Centers for Disease Control Prevention profile, the content, and we'll show you what it looks like on Quickbase, which is the application that both profiles will be submitted through. Then we'll talk about the Healthy Schools Act, talk about the content of the profile, some next steps and resources for the Healthy Schools Act. We're actually going to go into the Quickbase application and show you what that looks like and use it with you on the webinar so you can really get a feel for it and then answer any questions that you might have. So about the school health profiles, before we get started, we did want to mention that as the state education agency, OSSI is committed to continuous improvement. And here in the Health and Wellness Division, we are taking a look at all the data collections that are going on each year with the goal of easing the process for LEAs. So this year, we are releasing both profiles, both the HSA and the CDC profiles together. Hopefully this will avoid confusion and allow you to complete them simultaneously, which will be easier. So the period of the profiles will open January 15th, which is this Friday, and it will close February 15th. So it will be a month. In addition, the HSA School Health Profile has been reduced significantly. So we have looked at all the questions and we've taken out a lot of the questions, again, to just simplify the process for those that are completing the profiles.
Okay, so now I'm going to talk to you a little bit about the CDC School Health Profiles. And as Carolina mentioned, the CDC stands for Centers for Disease Control and Prevention, and this is a federal agency that has oversight over health in general, and within the CDC is what we call the DASH, which is a Division of Adolescent and School Health. And so the CDC School Health Profiles is part of a national collection done across different states and districts in schools. And it has two parts to it. And first of all, you need to know that it's only available for schools with middle school and high school grades. And so if you are a school with middle school and high school grades, you should have access to this profiles once you log in. But if you are in elementary school, you shouldn't have access. But if you do, please let us know so we can reduce that burden on you or confusion. So another thing to note about the CDC School Health Profiles is that there are two parts to it. One survey is completed completely by principal only, and then the other one is completed by teachers. So there's a teacher survey and a principal survey for the CDC School Health Profiles. And as far as the content that's covered in this School Health Profiles, we have school health education requirements and content, physical education and physical activity, practices related to bullying and sexual harassment, as well as school health policies related to tobacco use, prevention and nutrition, school-based health services, family engagement and community involvement, and school health coordination. And as far as how the data is used, this is really useful for the district as a whole, as well as OSSI specifically, in identifying professional development needs for our schools and staff. It also helps schools, especially for planning and monitoring health programs, and this is also based on identified needs from whatever you enter on the school health profiles, and it helps supporting health-related policies and legislation. Another big thing that the profiles data helps with is in supporting funding for schools. So based on whatever you enter in the profiles, we're able to not only see needs that we can address, but also for schools to see how you can seek funding based on your data collection from the profiles. And so if you are a middle school or high school, once you log into Quickbase, this is what you should see. So you would see here that on the left-hand side, there is the CDC principal survey and then the CDC teacher survey. So you would click on any of the links that apply to you directly. And also we have the option of clicking on a printable form, which is a PDF down below, where you can click on, if you decide to click and fulfill all the questions online, or offline rather, excuse me. So you can click on the PDF, and if that's easier, complete all the questions and then go back online to fulfill all the questions online.
So now a little bit about the HSA School Health Profile. This profile is required by the Healthy Schools Act of 2010, which is a law that was adopted by City Council and District of Columbia this year. So implementation of the law is mostly within OSSI, and as part of this law, schools are required to complete this profile, which documents school environment. So you completing the school health profile ensures that your school is in compliance with the Healthy Schools Act. Data that is collected through the profiles is used for reporting, for informing technical assistance, monitoring, evaluation. So it can be used, for example, by City Council for technical assistance. It can be used by OSSI to inform our grant programming. And it really just helps to answer if schools have a healthy environment that's supporting student learning. So if you are interested in obtaining this data for all schools, you can make this request through the OSSI website, and we would send you an Excel file which has the data for all the schools. So the school health profile, the HSA school health profile, is divided into 7 sections. So there are less sections this year because, like I said, we did shorten it. So you can see the sections on the screen right now. We do recommend that you hand each section to the person that's recommended on the profile. So under each section, you will have a recommended person to complete that section of the profile. This will be the person that will be best able to answer these questions. So we really do encourage you to do that. Now, I did want to go over some key questions with you that may be confusing to some. We want to make sure that we get information that's as accurate as possible. So for question 16, question 21, and question 22, these will all only be asked if you are a school that has kindergarten through 8th grade. So question 16, we're asking for the average minutes of health education over the entire year. So please separate this from physical education minutes if you teach these in the same course. For question 21, we're asking for average minutes of physical education over the entire year. For this, we don't want you to include recess. We don't want you to include before or after school physical education. And then question 22 is average physical activity minutes over the entire year. So this will include only time of the activity in the physical education course, so the time that students are actually active, and again, don't include recess, before, or after school. These are the same questions, but for high school, so grades 9 through 12. So questions 17 and 23, we're going to ask you for the units, the high school units that are required for your student to graduate, health education units and physical education units. So please report those. And then question 24, report the average physical activity minutes within the physical education course. And please answer these questions honestly. Again, these questions are just to be able to better provide technical assistance, to inform our grant programs, and to see how we, as a state education agency, can help you to increase the amount of physical activity and physical education that you are providing to the students and meet the goals that have been set. So the HSA School Health Profile also has a printable form that you can print out from Quickbase, and we'll actually go into Quickbase and show you in a little bit how this looks. After you submit your profile, you will receive a PDF all your responses, and it's required by the law that you actually post this on your website and you make it available in the main office to any parents that might want to see it. So you will receive the responses, the PDF, within the 30 days. Okay, and please go ahead and post this on your website if you have one and make it available to parents. Once you download it again, make sure you look at the sections and the contacts that are recommended in the sections, and we really encourage that you give it to those contacts so that they can fill it out appropriately. If you want further instructions, if you want to see a step-by-step technical guide with screenshots, you can actually go onto this link that you see here, aussie.dc.gov / what you see on the screen, and you will be able to click on a technical guide. And also, when you look at the school health profile, in the back, in the end, there's a question and answer section that you can use to guide you through the process. So it has some definitions, and it might be able to assist you with a lot of the questions that you may be wondering about. So now we'll go into how to actually complete the profiles. So you're going to log into Quickbase first. So for both profiles, you're going to be receiving an email if you haven't received it already. And for HSA, school principals and the 2014-2015 school health HSA school health profile will be giving access to Quickbase. And for CDC, principals and health teachers will be giving access to Quickbase. So you should receive that email just letting you know that you have been giving access to Quickbase. And to access Quickbase, you're going to, if you're a DCPS school, then you're just going to use your DCPS email, so your name.gov, and your email password. If you're a charter school, then you're going to use your charter school email address and the password for that email address. If you forget your password, just click on forget your password and you're going to get an email so that you can retrieve the password. If you have any questions or if you're having trouble signing on or any other technical issues, there is a number on the screen that you can call, and there's an email address that you can email. And this is the Aussie call center, and they'll be able to assist you and guide you through the process. If you need access and if you'll be completing the profiles for HSA, for example, for your entire LEA, then please specify that you're going to need access for the entire LEA so that they can grant you that access. So now we're actually going to go into the Quickbase application. So this is the website, the link, this is the web page. So it's octo.quickbase.com. And we actually are already in, so we wanted to show you what it's going to look like if you're a high school or middle school. So as you can see, you'll see the CDC profile up here, and you'll see the HSA profile up here. You'll be able to click on principal survey, teacher survey, and then the printable form is right here. If you are HSA, you can just click on the main survey, and then there'll also be the printable form. Also for CDC, you do have these two tabs up here. So you have the CDC Principal Survey tab and the CDC Teachers Survey tab. So right now we're going to click into this is what it looks like if you're just HSA. So if you're just an elementary school, then this is what you're going to see. You're going to see HSA profile. This is just the first page of the profile, basically. So to get started, just go ahead and click to complete. You're going to see in my screen there's several different schools. However, when you log on, you'll only be able to see your school, the school that you have been given access to. So if you want to edit it, you're going to click on the little pencil. If you want to just view it, you're going to click on the eye. So for example, if we were to click on, I'm going to go to a test school down here and click on edit. So you would go on, you would fill out all of your answers. Hopefully by this point you have completed them on the printable form and they're just ready to go. As you complete, just click on the drop downs, any check marks, just complete all the answers. And once you get to the bottom of the page, you have to click this completed part 1. Once you click completed part 1, click on save. You'll see that it's saved, and then it can kick you back to that original page where you would click on page 2. So as you can see for this one right here, there's a green dot under page 1 completed. So this is page 1 and this is the green dot. This means that page 1 was completed and submitted. And you would just do the same for page 2 and page 3. So by the time you've completed all 3 pages, you should see 3 green dots. And this is your confirmation that the profile has been submitted. You will not receive a follow-up email or any pop-ups letting you know that it's been submitted. Again, just if you have clicked on those completed check marks at the bottom and clicked saved and see the 3 green dots, then you can feel confident that the profile has been submitted. Okay, so I think that this is all that we wanted to share with you. It really is very simple. At this time, I do see that there have been some questions that have been asked. So let's go through them. Okay, so these questions are about specific questions on the profile. So what happens if you are a school grade 6 through 12? When you have the grades, you'll have the grades that you'll put. So you would click on 6, 7, 8, 9, all the way to 12 if those are the grades that you have in your school. And you're just going to get follow-up questions for all those grades. So you would answer questions for 6th through 8th grade, basically. The Quickbase application is set up so that depending on which grades you choose at the beginning, you're going to get those follow-up questions. Okay, for the question on if the service is provided by a partnership or if it's contracted, if this is an HSA question, if this person could please put your email, I will contact you directly and help you through these specific questions that you have so that we can talk about these. Perfect. So I just got your email. I will follow up with you regarding those specific questions that you have. Now, do all teachers need to complete the teacher survey or just recommended teachers who are connected to the school's physical education?
Okay, so I can answer that. I believe that's a CDC question. If not, you can correct me in the question box there. But for questions related to physical education, we would want that to be completed specifically by a PE teacher, or if in your school that's covered by a health education teacher, that's fine too. But we do want it to be answered by teachers working directly in that content area.
Okay, now does anybody else have any questions right now? We are going to put this webinar online so that you can access it if you need to. Again, the links will be there so that you can go then onto the Aussie website, and then it will also be available for anybody that was not able to make it. Again, you have the Aussie call center, which they can help you with any problems that you have with the application. And if you have more, if there are more specific questions, you know, they always do reach out to us for those questions. Okay, so we'll wait just a couple more minutes to see if any other questions arise. And if not, thank you all for joining us today. I hope that this was informational and brief enough so that you have some knowledge as to how to move forward with both profiles.
Thank you very much, guys.
Yeah, we're going to be just posting it on the website. If you wanted, we can go ahead and send it to you if you think that that would be helpful. Okay, so we got another question about the call center email address. So I'm going to put that back up on the screen quickly so that you can see it. So there you have the phone number, and aussie.callcenter@dc.gov is the email that you can email any technical issues with, or if you need access to the profiles, if somebody in your school is going to be completing it and hasn't received access. Okay, so it seems like we've answered all questions. Again, you have all this assistance to help you through the process, so please feel free to reach out at any time. And thank you again for assisting.